here today, and we've got lots of topics, but the topic we're going to talk about today is something that all of us are wondering about, and that's Coolsculpting. Hi, Doc.
Hey, Francine, how are you doing?
Coolsculpting, Doc. I'm doing great. Yeah, my neighbor wants to get Coolsculpting. She's really thin, though, so I'm like, I don't know if you're a candidate. So, when it comes to Coolsculpting, what is it, if you had to explain it?
Well, Coolsculpting is very simply, just to make it simple, is freezing the fat, okay? A lot of the way people, especially plastic surgeons now, are getting rid of fat is through kind of heating the fat or burning the fat, okay? Well, this particular type of method is actually where you freeze your fat cells, and basically what they found was when you do that, they kind of have to kill themselves, and basically that's how you lose your weight. Been doing it at the clinic for probably around 5 years now, doing pretty well. Seeing pretty good results with it. So
okay, good results. That matters, right?
Yes.
So where is Coolsculpting from? Is it the doctors used to use a different method. Now this is the method. Where did you find out about it, and who's the best company out there with the best equipment?
Well, it's only one company that does it. So it's Coolsculpting is kind of a proprietary machine. It was discovered by Harvard physicians in about 2011, 2010 kind of thing. And 2009, I think, was when it was discovered, and they started doing it in 2010. But what they found was, and this was coming from a couple different observations. The first was they were noticing that when children were sucking on popsicles for a long period of time, they would get dimpling. And the other thing they noticed was with Scandinavian women riding horses, and they noticed dimpling in their legs when they were wearing shorts or something when it's really cold outside. So they saw that something's going on. Cold is doing something to this fat. And what they found was when the fat gets frozen in the cell, it causes it to crystallize, which will damage the cell membrane. And when cells have a damaged cell membrane, that's the outer shell of the cell, they can't survive. So they have to commit suicide. We call it apoptosis, okay? And they found it's a gradual process over 2 or 3 months, but they saw maybe about a 23 to 24% reduction in fat per session, so it's cumulative. So if you do 2 sessions, it's going to be about a 48 to 50% reduction, and so on, okay? So it was discovered by the Harvard physicians. They put it into a machine, basically, that attaches to you, and basically it brings the fat between 2 plates that cool, and basically causes these fat cells to kill themselves.
Awesome. So this process, you're going to explain this to us when we come to Revita. So what does that process look like? Okay,
so when you come into Revita, we bring you in, we look at your history. We want to see what you want to do. Now, not everybody's a good candidate for Coolsculpting. The first thing, we want to make sure you're a good candidate. Coolsculpting is not going to make you lose a whole bunch of weight. Just as the name means, it's going to sculpt you. So most of the areas that you attack with Coolsculpting are the fat-resistant areas or exercise-resistant fat areas. Usually that is the belly area, the flanks, we call muffin tops or love handles in men. Some of the back areas, the bra line. They actually have, they're cleared for now doing the inner thighs. They even have a device for the outer thighs, but we haven't started using that one just yet because it's fairly new. So the first thing we want to know is make sure, are you a candidate? And basically you'll know you're a candidate if you can pinch the fat, is what we call it. So if I go up to somebody's belly and hopefully somebody's in my clinic, and pinch the fat, if you can pinch an inch is what we call, then you may be a good candidate for Coolsculpting in that situation. So that's the first thing. We bring you in, we look at your history, make sure that you don't have any disorders that are worsened by cold. An example would be Raynaud's syndrome or cryoglobulinemia. If you have it, you know what it is, but basically things that in that nature that can make you have issues, it can cause problems if you subject somebody to cold. So those candidates are pretty much ruled out. Then we do a measurement test. We see what is the best device head to put on you. And we do that, we write that down, and then typically you'll come back, we'll schedule you for a follow-up to do the actual procedure. Procedure takes about an hour per area, okay, or per head. So typically people will do 4 areas, 3 to 4 areas, so it's usually about 4 hours. So that's why we bring you back and schedule you at that time. It's not painless as you start the device. We don't do any cutting or any injections or anything like that because the cold acts as an anesthetic. So over time, as you're on the device, usually about 5 minutes in the device, you don't feel anything. Maybe the most uncomfortable thing you'll feel is maybe the suction, because you do have a vacuum that pulls the tissues between the two plates and kind of keeps it between the two plates. And that may be a little bit uncomfortable initially, but in all cases it goes away. I did do it, so I know what it feels like. It is a little bit uncomfortable, but as soon as it starts getting cold, you don't feel it anymore.
Awesome. This is good to know. So the results,
Yep.
are they automatic, Doc, or do you have to wait for just a little bit?
They're not automatic. Most people will see reduction or full reduction of what we say about 23 to 24% in 2 or 3 months. Okay, so it's a gradual loss. So if a lot of people come in, the first thing a lot of people ask me is, "What about my skin? Will I have a lot of skin hanging off?" No, because it's so gradual over time, it allows the skin to regain kind of its elasticity. Now, if you're somebody that's 400 pounds, yeah, you might have some skin hanging off after that, because you're kind of exceeding the limit of what the skin can hold as far as elasticity. But if somebody's coming in and they're normal weight, but they have this little pooch, no, it's not going to cause any skin to fall or to have extra skin. Typically, it will kind of gradually go away. And then usually after 3 months is the maximum per that session, but we usually bring people back in 4 weeks if they want to do another session, and it typically is cumulative. Like I said, you can each time it's another 23 to 24% reduction.
Awesome.
So somebody, if they're skinny and they have a little pooch, they're not going to see a 23 to 24% reduction, but they will maybe see close to 50% reduction. Bigger person will definitely see a 23 to 24% reduction, but most people, we tell them 2 sessions typically is the minimum we want them coming back, because we do want them to see the difference. So.
Oh, awesome. This is great. We're talking to Dr. Peter Fatinos today. I want to thank you for talking about Coolsculpting. Now you have put all the myths to rest, so we know, right?
Excellent. Yes.
Yeah. So we can call 704-847-0011. That's 704-847-0011. Or just hop online, revitamedical.com.